Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Next, facial recess of the posterior sinus is bound medially by the vertical part of the seventh nerve, laterally by the chorda tympani, and above by the fossa incudis. This is true. Next, while doing posterior tympanotomy through the facial recess, there are chances of injury to the following except there are chances of injury to the chorda tympani, dislodgement of short process of incus from fossa incudis, and vertical descending part of the facial nerve is involved, not the horizontal part. It is vertical descending part which is involved. Then, true about facial recess is a suprapyramidal recess. It is important for cochlear implant. Middle ear can be approached through it. It is actually bound laterally by the chorda tympani. It is bound laterally by the chorda tympani, and it is bound medially by the seventh nerve. Next.
thank you and thank you for watching.